Hey, everybody. Welcome back to another episode of Tattoos and Telehealth. I'm Kelly White with Kari Health. This is my good colleague, Nicole Baldwin with Hamilton Health and Wellness. We're going to chat with you guys today about the telemedicine space and how we can kind of fill in the gap with rural healthcare and what we like to call the healthcare desert. And that can be a lot of different things, right, Nicole? So that can be like if someone
Can
lives in a
be.
rural setting, if somebody lives in a setting where maybe they don't have good access to care for whatever reason, they have limited providers in their area. Or I even kind of think of it as like if someone who is maybe they're between insurance companies, like they're
Yeah.
in a gap where their prior insurance has left them, but their new insurance hasn't taken over, that's a healthcare desert, in my opinion, because they don't feel like they have access to care. Because a lot of us, if we think, hey, I don't have insurance, maybe I don't really have access to care, right? So we're going to chat with that a little bit today, but I do want to tell you guys as a reminder, because our lawyers make us say this is not medical advice, nor does this video constitute a patient-provider relationship. So let's just get all that nonsense out of the way real quick. But Nicole, will you talk to us a little bit about why that means so much to you and why this particular topic is such a big deal for you?
Yeah, sure. So like Kelly said, the desert of healthcare doesn't have to mean that you're literally in the desert and you don't have access. It can mean that, of course. And in the truest sense, that is what that means. There's not enough providers to go around, right? There's just not enough. There's a shortage, and that shortage is growing every single year. But also patients that have lost their insurance or they don't have good coverage, but they have a UTI or a sinus infection and they can't get in to see their doctor or pediatrician. The term bridge care, that's where that came from. Telehealth providers were bridging the gap between you and your primary care because the primary care system is so overwhelmed just with the nature of the beast, right? That's not a secret. Baby boomers, population, less people going into medicine, more people getting out of medicine, which is a whole nother podcast. However, it does lead patients into like, what the heck do I do? A lot of doctors and nurse practitioners, COVID kind of pushed them into retirement and they're like, I'm out. And there's probably nothing more frustrating than having an established provider that knows you and knows everything about you. And then you're like, I have to start all over again. And that's something also that sets our practices apart, Kelly, is you and I, is they're going to get the same provider every time. You're going to
That's right.
see me every time. A lot of the stuff that I know we both do is asynchronous, meaning that it's chat based, but you're going to get me and my team every time. You're going to get Kelly and her team every time. And so just taking away that frustration from, I don't know who I'm going to see today. I don't know if I'm going to see the doctor. I don't know if I'm going to see the nurse practitioner. I don't know if I'm going to see the physician assistant. I don't know if I'm going to see a completely different person. I don't know. So, that is a plus to coming to one of us, to our practices. But back to the healthcare desert, there is such a shortage that the reason why I went into medicine, not medicine, telehealth, it was actually before COVID. And I knew that there were states out there and locations out there where patients just don't have access to medical care. They have no doctor's offices near them. They're 30 minutes, an hour, 2 hours away. They're limited, or they're traveling and they don't have one in that area. That's where we come in and we can say, hey, we can help you in that time. And for the patients that live far away from any kind of CVS or Walgreens or drugstore, in most cases we can get your meds shipped to you without a problem. We can send them to a pharmacy that we've vetted through our practices, and we can get your medication shipped to you, and a lot of times overnight. So yes, there's a healthcare desert, and by that, we do mean being somewhere where you have lack of resources, which, if you live off the grid, you're going to have lack of resources, right? And that's okay, right? You're just trucking along. But it may be a desert, meaning like a temporary thing. You're in between insurance, like Kelly mentioned. You don't have insurance. The employer that you have doesn't offer insurance. You work for yourself, that kind of thing. And we both see teams. Kelly and I both see teams where we have had people come to us and say, look, I have this small group. We want to know if you'd be our preferred provider. And they kind of just keep us on the side so that we can see everybody in their team. So that's something that we do offer as well. But telehealth is just becoming easier, even in the areas where there is resources. It is much easier for my patients to hop on for a sinus infection, or, their kid is sick from school. They need a school note to hop on a 10-minute visit, 15, whatever it needs to be, then go to urgent care and sit in the waiting room with everybody sick around you. Like, it's just such a better option. Now, certainly there's times when, of course, you need stethoscope and you need, your heart rate and your EKG and all that stuff. But a lot of times it really isn't. A sinus infection doesn't necessarily require all that. So we definitely want to continue to fill that gap. And that's where Kelly and we've been doing that for several years now.
Or even like kids in sports, especially with school starting back up, kids playing football. I've had a couple of kids that were sick in the early part of school, and coach was like, sorry guys, you got to have a note to come back in, or I need a note for you to come back for this because they missed a practice or they missed whatever. And
Yeah.
that was an easy fill in for them. Their mom called and said, hey, so and so was sick. He stayed home this morning. Can I get him a note for his coach? Absolutely. Yeah.
Absolutely. Because I don't want you to have to go to the pediatrician or to the primary care just to sit there to get a note. Your child had a cold. It didn't require necessarily any antibiotics, but now, don't waste the time of your in-person provider. They're busy.
Yeah.
They're super busy.
Want a
Just
note?
hop on and say, hey, I need a note. I don't need anything else. That's all I need. Absolutely. No problem. Just give me some information, some basic stuff that we need. We can email it right to you.
Out here where I live, the healthcare desert is a real thing. Like the rural setting is a real thing out here. So where I'm at, the hospital that I was contracted to pre-COVID, we service 19 counties. So where I'm at is very, very vacant, I guess you could say. And so we have their nearest hospital is 3.5 hours west, 3.5 hours east. 4 hours, I think, is the biggest hospital south. And so we really were in the middle of nowhere. And so there is a huge need out here in the literal sense of a desert whenever you think about people in these rural cities. And they're little farming communities, like you drive in, drive through, and if you blink, you miss it on the way out, And so these are little farming communities where people they don't have access to care. There's not an urgent care. There's not a walk-in clinic. There's not anything for them to go to. And these people don't have time to drive 35, 40 minutes an hour to a walk-in clinic to be seen. And so telemedicine helps to bridge that gap for them. It helps give them an opportunity to log in, see me asynchronously or via chat and say, hey, we don't feel good. This is what's going on. I can take care of them in 15 minutes max, get them a prescription on the way. And like you said, there's so many online pharmacies now, and I won't say anybody by name because I don't want to get in trouble, but there's a ton that have popped up now, and there's online pharmacies, or there's oftentimes little pharmacies close to them that will make a little DoorDash to them. And so it makes it so easy for them. And that became a very real thing. And I understand, Nicole, that the healthcare desert was really what lit a candle under you. So tell us a little bit about that passion that fueled the bug under you.
Sure. So, where I currently live, there's population growing everywhere. It's just booming. But I knew pre-COVID that I wanted to help patients because the area that I'm in right now was rural 20 years ago, right? And so I wanted to reach patients that wouldn't otherwise have access to care because there is such a shortage. And so that really fueled me. You know what? I really need to get licensed in other states, because if I do that, then I can help them. I can truly help a wider variety of patients, because not everywhere does have that desert, but a lot of patients do live in a healthcare desert where there isn't those options available, or we're much cheaper via telehealth. I mean, we're super cheap. Me and Kelly are both flat fee, cheap.
And oftentimes it's cheaper than going to a walk-in clinic or your copay.
Your copay. A lot of times your copay is $100. I mean, we're cheaper, but it's super important that patients know they can reach out at any time. They can reach out, they can text us, they can message us, they can set up a video chat. Some patients just like this fluid conversation. Most patients just say, hey, I'm okay with chat unless my state requires it. They're totally okay with that. So it really fueled me to say, okay, I really want to take care of these patients that are in these rural areas, because that's where I come from. I come from a dairy land. I come from, the farmland, which I miss it very much, by the way, but I was there. And so that drove me to say, okay, I want to provide this service to others now that I'm in medicine, and I can do that now. So really what drove me to telehealth. And then COVID happened, and it was like everything's closed. Everybody was pushed to do telehealth. And now it's, it's a thing. But Kelly and I have been doing it for a very long time. And we just super enjoy it. We actually have the time to talk to our patients, right? You enjoy that time that you have with your patients. You're not trying to.
I love it.
There's no admin saying you got to see 4 or 5 patients in an hour, forget your lunch, forget time to pee, just forget it altogether.
Got no medical assistant over my shoulder going, you've got 3 more patients in rooms waiting for you. There's none of that. I love it.
None of that. There's none of that. And we don't overload ourselves. That's the important thing. We don't overload ourselves to the point, because we don't have to, right? We're not pressed by insurance. We're not pressed by administration to say, look, you got to turn a profit. And that's unfortunate. It really, really is unfortunate. We don't have that. If you need to spend 5 minutes, 10 minutes, 15 minutes, if you need to spend 20 minutes, if you need to spend 30 minutes, if you need to do everything via chat because you're at work and you're trying to squeeze stuff in, if it's late in the afternoon, if it's early in the morning, we have options, and it's just super easy. You don't have to download anything fancy. You just find us on our website. So you can find me at www.hamiltontelehealth.com. And Kelli, she loves taking her time with patients and really digging through. She does a great job of that.
You can find me at www.carihealth.com. That's CHARI health.com. And like Nicole said, I am happy to spend as much time as you want or as little as you want. If you need a quick in and out 5 minutes, we can certainly do that. If you want to sit and talk to me for an hour, I'm your girl. I'll sit and chat with you for an hour, whatever we got to do to take care of you. But I think that's all the time we have for today. Nicole, thank you so much for sharing your bit about the healthcare desert. And I hope this helps people know what that sounds like, what that means, and what we can do for them. If you feel like you fit into one of those categories, or if you just feel like healthcare is not an option for you because of whatever reason, guys, jump on, hit our websites, hit us up. We can probably help you.
Whether you need an antibiotic, you need an antiviral, you're not sure what's going on with you, you need a school note, you need a work note, you have a UTI, you want us to order labs and go over them with you and tell you what they need, you want an order for your mammogram, we can do all of that. All of that stuff we're able to do.
Our teams are amazing. Even if we don't have what it takes to take care of you, if we can't, we will tell you that we can't. We will tell you where to go, and we will help you get there. We will help you find the tools. We want you to be taken care of. We want you to be healthy, happy, successful. We want you to have everything that you need to be well. So please know that we are here for you. We are here to help take care of you. Thank you for joining us for another episode of Tattoos and Telehealth. Until next time, see you guys later.
All right, see you guys later.